RFK's comments at last week's cabinet meeting downplayed the outbreak.
There have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
Since he said that, the outbreak has not only spread, it has claimed the life of a child, the first death from measles in a decade. And the chief spokesman for HHS announced today his immediate resignation. Sources say he disagreed sharply with Kennedy's handling of the measles outbreak. Joining us now for more is President Trump's CDC Director during the COVID pandemic, Dr. Robert Redfield. Doctor, great to have you. You are a supporter of RFK. You are also a believer in vaccines. RFK did acknowledge the measles vaccine works, but said, and this is a big but, he said vaccination isn't a personal choice. Should he have said more?
You know, Elizabeth, I've always been an advocate that we should make vaccines, we shouldn't mandate vaccines. And the reason I feel that way, and I'm a big advocate of vaccines, as you know, I spent my life developing them, is that when you force somebody to do something you don't want them to do, they don't want to do, you just reinforce the hesitancy. And I think we saw that, unfortunately, with the COVID vaccination policies of mandating the vaccine, that really all backfired and caused a lot of vaccine hesitancy, not just for COVID,
but for everything else. But so then how do you get community immunity, herd immunity?
I think you have to, and when I was CDC director, I really called on my medical colleagues to spend the time to explain to people the importance of vaccines. Most parents don't vaccinate their children. The reason is they don't want to do anything that would harm them. They're afraid of making a mistake. So you have to spend time talking to them to let them know that the real mistake is not vaccinating your child. A few of them have what we call misinformation, and then you have to correct that misinformation. It may take 1, 2, 3, 4, 5 visits. And there's a very small number of people that are just really anti-vaccine.
It doesn't feel like that's very small. I mean, well,
I do that are really critically anti-vaccine. I call on the medical community to step up and interact with the patient population to reinforce in them the value of vaccination. So I think Kennedy did a good thing in making it clear that this vaccine works. It's important. They've sent several thousand vaccines to Texas. I was just in Texas the other day, met with the health department there. The HHS is really supporting them, CDC, to try to get this outbreak under control. It's unfortunate, you know, most of our measles cases are imported from Europe because they didn't eliminate measles. We get them from Italy, we get them from Germany. I just encourage people that are listening to your show tonight, if you have children that aren't vaccinated, please get them vaccinated against measles, mumps, and rubella.
RFK says in his op-ed that while there are no approved treatments for measles, he says vitamin A could work to help those infected, and that, quote, good nutrition remains the best defense against most chronic and infectious diseases. Is that true?
Yeah, it is really true that high-quality nutrition is important in general. Vitamin A...
But is that going to keep you from getting measons?
No, the vaccine is what you want
right,
to keep getting measles.
The point is that in an op-ed, Doctor, in an op-ed about measles, he's talking about vitamin A and good nutrition.
Well, because there's data now, meta-analysis that was recently done, looking at multiple studies that showed the high-dose vitamin A group had an impact on mortality. CDC's revised their recommendations, so there is some evidence that vitamin A can have some impact, but that is not to replace vaccination. Remember, pregnant women can't get vaccinated.
Right.
Remember, children under the age of 2 aren't vaccinated. That's why
That's why we need herd immunity.
That's why herd immunity is so important. The area where this outbreak broke out, and I know it pretty well, they had an 82% immunity rate. We need about 93% or more to have herd immunity.
Yeah.
They had 47% of the children had a religious exemption from getting vaccinated.
Right. There's a Mennonite community there. Yeah. All right. Dr. Robert Redfield, thank you for giving an important public health message to everybody out there that the only protection against measles is this vaccine.
Is a vaccine.
Okay.
It's safe, it's effective. Get your children vaccinated.
Thank you, doctor. Appreciate that. Thanks so much for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.